there's a lot of questions that that needs to be opened up about this, because that is horrifying in today's day.
Yeah, there was some they're actually being sued and convicted of criminal activity. Obviously, there's like a blend of the two because there was fraud, there's been some tampering of, like you said, billing and documents, and what the, hiding and destroying documents. So it's very well, and you'll see that in the video. We'll get to the video in a second. Dr. Angeline, what was your initial reactions?
My initial reaction was welcome to the plantation once again,
Mm,
because my work deals with the plantation and how our systems still show up with plantation all wrapped up through and in them. I was angry. It really took me a minute to even catch my breath. I'm like, how
mm,
do you allow 500 at one hospital and not see something is going on? And
mm.
so I'm super excited to get into the conversation. But that's exactly what I thought. Here we go with the plantation all over again.
Yeah.
Mhm.
As an RN, dominate. What did this make you feel like? First of all, have you ever seen malpractice at this level? Have you ever seen anything like this in all of your years of RNing? Tell me what your reactions were, and have you seen this kind of malpractice?
So I haven't seen this type of malpractice, but I've seen things that would make you say, you
Mm,
know. I think it's sad. Let's start there. It's horrible. It's sad, but I'm glad that they're putting light to it, because there's going to be accountability. And so moving forward, they're going to put more regulations and things in place that stop this. So
mm,
working in a facility, what I will say is in terms of informed consent, if people don't read that stuff and they come
mhm,
in and the doctor go over real quick and say sign here, and you sign and you don't even know what you're signing, so they may tell you one thing but you're signing a form. So if you're not, as a nurse, like I always advocate for my patients, so just being able to say, hey, do you understand what's happening? Do you understand
mhm.
what's going on? You read this. I think that's important to kind of prevent that. That's why I didn't see that, because I did pay attention to stuff. I did advocate for my patients, but this is just, it's sad and it's horrible.
Mm. Well, let's break off into this video and see exactly what we're dealing with here. I'll start with something. I'll start it off easy. Let's just understand what's going on. Okay. All right. All right. And here we go.
So, this story out of Virginia is wild. Three former top leaders at UVA Health are being sued in federal court for alleged fraud, retaliation, and racketeering. The lawsuit claims their actions endangered patients and may have led to at least two preventable deaths. The plaintiffs include four UVA physicians and two widowed spouses. They're accusing former UVA CEO Dr. K. Craig Kent, former med school dean Dr. Melina Kibbe, and former hospital CEO Dr. Wendy Horton, plus several current UVA surgeons, of falsifying records, improper billing, and punishing whistleblowers. They even claim leadership dismantled patient safety safeguards during COVID to keep revenue up, continuing elective surgeries, and taking all transfers despite limited capacity. Now, this isn't some fringe complaint. A no confidence letter signed by 128 faculty members last year accused those same leaders of creating a culture of fear and putting patient care at risk. The lawsuit cites racketeering, fraud, defamation, and negligent hiring. The plaintiffs are asking for damages and outside oversight of UVA Health. Both Dr. Kent and Dr. Kibbe are denying the claims, calling them baseless, and saying they'll be vindicated in court. The University of Virginia says it doesn't comment on ongoing litigation.